President Biden is participating in a virtual G7 summit event on Friday, where he plans to discuss America's efforts to combat the coronavirus pandemic. Now, this comes as Americans anxiously watch the spread of new COVID-19 variants across the U.S. A study released Sunday shows scientists have found at least 7 new variants that seem to have originated here, all carrying the same mutation. So for more on this, let's bring in Dr. Ron Elfenbein. He's a medical medical director and owner of First Call Medical Center. Thank you so much for joining us. So, listen, I hear 7 new variants, and it sounds really concerning. They seem to share a lot of similarities, though, so maybe that's a good thing. What do we know about these new variants?
Good morning, Anne-Marie. And yes, you're right. I am a medical doctor, so you got that part right in the intro. So I kind of consider these variants like cousins, and it's an example of what we call convergent evolution. So, for example, birds, bats, and insects have all adapted to be able to fly, but they obviously did it through different methods over different time frames. So it's the same example with these viral mutations that you're talking about. It is the same mutation across 7 different strains that have been sort of identified, or 7 different variants rather, not really strains. It's the 677th amino acid in the spike protein, and for whatever reason, this clearly gives the virus some sort of genetic advantage over its cousins, or it's the regular variant, if you will, because clearly it's developed 7 separate times throughout the entire country. So there's something about that particular 676 amino acid in the protein that makes it more likely to become infectious or to survive or whatever. We don't really know, but that's why we're seeing that. Remember that we've talked about this before, that the United States only sequences less than 1% of the total number of tests that we do, whereas a lot of other countries are doing 10 and 20%. So we are woefully behind the rest of the world with that. So we don't really know how widespread these are, or how many variants there really are. We've identified 7, as you said, in that study, but there could be many more. We don't know.
So the New York Times also reports that government scientists in Britain now believe that the variant that was first detected there is most likely deadlier than the original virus variants. And, this comes as, I think it was last week, we heard at least predictions that that variant could be the dominant variant in this country by spring, by March. We are also seeing, individual states lifting some of their COVID restrictions. So when we hear about the emergence of new variants, plus perhaps the domination of this particular variant, which could be deadlier, coupled with lifting of restrictions in some states, what's your reaction?
Yeah, it's a good question. I think people, the way you framed it, sort of, it's kind of scary, and people get nervous about stuff like this, and it's understandable because you keep hearing about all these new variants, and this one's more lethal. So the UK epidemiologists in the UK have said that they believe that it's most likely more lethal, and they think that's the case because it's 40% more infectious. So it's the UK variant I'm talking about, the so-called B117 variant, that is the one that you're talking about, the UK variant that is supposedly going to be the dominant variant in the United States by March. They believe that it's 40 to 50% more easily spread than the quote-unquote normal variant, or the normal virus that we've been talking about for so long. Which clearly, if more people are getting infected, more people are most likely die. So that part is not necessarily that unexpected. We don't really understand if it's truly more lethal, or again, if it's just that more people are likely to catch it. We don't really understand that part, and we don't really understand what makes it more contagious. Is it just that it's a higher viral load? Is it that particular variant has a mutation in the 501st amino acid on the spike protein? So again, is it that, or is it just that it's more, that the people have a higher viral load in their nose, making it more infectious? We don't really understand. So we don't really have enough science to determine how worried we need to be, or what's causing the questionable increase in mortality and likelihood to be hospitalized.
All right, I want to ask you about something else that a lot of people are talking about. The CDC released guidelines for the reopening of schools on Friday, and it had a lot to do with the community spread. So depending on where you lived, there would be a greater or less likelihood that the schools would be able to be open, and to varying degrees. In some cases, it's just for, the little kids, and high school kids would stay home. It was very there were different levels. But the interesting thing about it is that more than 91% of students in the U.S. live in areas deemed red zones, which means their schools wouldn't be able to open anyway. I want to get your take on that. I understand you have to be cautious moving forward, but there was this really kind of enthusiastic push to get kids back in school because they're losing out on a whole year. And in fact, the numbers indicate that children are not contracting the virus while they're in class. Of course, that's based on the schools that are open right now, and I would suggest that probably some of those schools have fewer kids in the class, bigger classrooms, most likely private schools that make it a lot easier to bring the kids back into the classroom without risking anyone's health. But, you saw the CDC guidelines. What do you make of it?
Yeah, so first of all, they're not mandating anything. These are just recommendations. The CDC guidelines, as you said, they are guidelines and recommendations. They're not mandating anything. Unfortunately, there was really no emphasis on ventilation, which a lot of people commented on, and I found that very interesting, that we know the virus is airborne and is spread by respiratory droplets. So you would expect that the CDC would have come out and said something about ventilation, improving ventilation in the schools. They didn't even talk about it at all. They specifically mentioned vaccinations, which are not necessary to open schools. So that's an important point to take home, that we don't require vaccinations of teachers. They did say that elementary schools can open really regardless of what, because we do know are very, very low in schools. Interestingly, the data that they looked at, and that's out there, is not just from private schools, but it's from the European Union also. Most countries in the European Union have reopened their schools. And I think we have to temper this whole question of when it's safe to reopen schools by the damage that we're doing to our kids. It's not just that they're not learning and they're losing a year of education, but all the socialization, all the depression that we're seeing amongst our kids, the increased likelihood of drug use, all these horrible things that are going to be coming out of this that we really can't measure yet, but we can identify the risk factors for it. And those risk factors are off the charts. So, we are doing our kids no service by keeping them out of school. I think that we need to just open the schools as quickly as we can. Now, of course, we shouldn't run into this, with our hair on fire and do this not safely. But the science is pretty clear that, as you said, that the transmission rates in schools are incredibly low. So, I think the CDC kind of is sort of trying to play both sides here. They're trying to appease the teachers' unions and that side, and also trying to make it so, yeah, we can open the schools. But as you said, the requirements are so stringent that no schools can really open right now, according to the CDC guidelines. So, I think we really have to take another look at that. And I think like I said, we're not doing our kids any service by keeping them out of school any longer.
Yeah, I think it's a great point. We've been talking throughout the morning about this COVID relief bill that is needed. And listen, you're not going to be able to open schools unless you do make some major investments in the infrastructure. Ventilation is one of them. So some of these schools are going to need an overhaul. And it's about a little more than sort of wearing masks and washing your hands at this point. Dr. Elfenbein, thank you very much.
Thank you. Have a good day.